Retinitis pigmentosa, glaucoma, and diabetic retinopathy. Can acupuncture actually help? These are three devastating conditions, three honest answers, three different diagnoses, three completely different conditions affecting the eye in three completely different ways. And yet, the patients who come to us with retinitis pigmentosa, with glaucoma, and with diabetic retinopathy tend to share one thing beyond the vision that they are losing. They share a conversation they have had with their doctor. The one where they're told that the options are limited, that what can be done is being done already, and that beyond the medications and the monitoring and the injections and the drops, there isn't much more that they can do. That conversation is one of the most difficult a person can have because these are not abstract conditions. They are happening to your eyes, to the vision you used to live your life. And being told that medicine has done all that it can do and that what it can do isn't enough is a particular kind of grief. So today, I want to give each of these three patient groups something different. Hello, I'm Dr. Rebecca Gibbons, and I want to talk about what is actually happening in your eye, why conventional medicine runs out of answers, when it does, and what AcuNova treatment can do. This is a specialized acupuncture protocol developed by Dr. John Boel in Denmark that can realistically offer you hope. So retinitis pigmentosa, a genetic condition, and one where conventional medicine has probably the fewest answers of all. RP patients are often younger, have lived with this diagnosis for a long time, and have profound grief around it. If you have this diagnosis, you probably received it younger than most of the patients watching these series, and you have likely been living with something that most people around you cannot see or fully understand. And that is a slow narrowing of your world. RP is a group of inherited genetic disorders that cause progressive degeneration of the photoreceptors in the retina, specifically the rod cells, which are responsible for peripheral vision and vision in low light conditions. As those rod cells deteriorate, the visual field narrows. What begins as difficulty seeing at night, blindness, trouble in dim restaurants, stumbling in the dark spaces, progresses over time to tunnel vision, and in many cases, severe impairment. The cones, which handle central and color vision, are typically affected later in the disease. But in advanced RP, both rod and cone function can be significantly compromised. What does conventional medicine offer RP patients? Unfortunately, very little. There is no approved pharmaceutical treatment that meaningfully slows retinitis pigmentosa. For most patients, vitamin A supplementation has shown modest benefits in some studies. A retinal prosthesis, essentially a bionic eye, exists for severely affected patients with specific gene mutations, but is only available to a narrow group of people. Gene therapy trials are ongoing for certain genetic subtypes, but are not yet broadly available. For the vast majority of RP patients, the conventional conversation is, we will monitor your progression, we will support you with low vision aids, and we are watching for the research. This is genuinely inadequate answer for someone that is losing their eyesight, right? So how does AcuNova address retinitis pigmentosa? Though there's three different ways I want to go over. So first, the photoreceptor support. AcuNova stimulates increased circulation to the retinal tissue. It improves the oxygen and nutrient supply available to photoreceptors that are under genetic stress. Cells that are struggling to survive in this environment are more likely to continue functioning when that environment improves. So number two, it slows progression. So multiple RP patients treated with AcuNova internationally have showed progression on objective testing, visual field testing, over follow-up of periods. The goal is not reversal. The goal is extending the functional life of the remaining photoreceptors for as long as possible. So function number 3 is that some RP patients, particularly those treated earlier in the disease, report meaningful improvement in night vision, contrast sensitivity, and the quality of remaining peripheral vision following our intensive treatment. These are not universal outcomes, but they are documented and they are real. So, what is the realistic expectations? The earlier in the disease course, the more AcuNova has to work with. If you are in the early to moderate stages of RP, if you still have meaningful visual field remaining, the case for pursuing AcuNova treatment is very strong. So the goal is preservation, slowing the narrowing, giving you more years of functional vision than you would otherwise have. For patients in more advanced stages, significant visual loss or field loss, severely compromised cone function, AcuNova may still offer meaningful improvement in the quality of remaining vision and in functional daily tasks. But those conversations are more individual and require a proper assessment and conversation. And this is exactly what the consultation is for. So now I want to move into talking about glaucoma, which is sometimes called the silent thief of sight. Because unlike macular degeneration or retinitis pigmentosa, glaucoma often causes no pain and no obvious visual symptoms until significant damage has already occurred. By the time many patients notice something is wrong, a meaningful portion of their optic nerve has already been lost. And glaucoma is not a single disease, it is a group of conditions characterized by damage to the optic nerve, most commonly associated with elevated pressure inside the eye. The optic nerve is the cable that carries visual information from the retina to the brain. So when that nerve is damaged, the information can no longer travel and vision is lost. Peripheral vision typically goes first, which is why patients often don't notice it until it's more advanced. The most common form, open-angle glaucoma, is the one most patients are familiar with. Less common, but equally serious forms include normal tension glaucoma, where optic nerve damage occurs even without an elevated eye pressure. Now, let's look at what conventional glaucoma treatment does and what it doesn't. What it does. So it lowers intraocular pressure. Eye drops, laser treatment, and surgery are all designed to reduce the pressure inside the eye, which slows optic nerve damage in most forms of glaucoma. This is genuinely important and life-changing for many patients. Let's look at what it doesn't do. It doesn't repair optic nerve damage that has already occurred, improve blood flow to the optic nerve, or address the vascular factors that contribute to glaucoma progression, even when pressure is controlled, which is why so many patients continue to lose vision even after controlled intraocular pressure. And it is essentially nothing to offer the significant subset of patients with normal tension glaucoma where pressure is not the primary driver. So there is a gap here. Patients are on their drops, their pressure is being monitored, they come to their appointments, and yet at appointment after appointment, their visual field continues to shrink. And they ask their ophthalmologist why, if their pressure is controlled, they are still losing vision. So the answer is that elevated pressure is not the only driver of optic nerve damage in glaucoma. Vascular factors, specifically compromised blood flow to the optic nerve head, play a significant role in many patients. So how does AcuNova address and treat glaucoma? So first, we increases the blood flow to the optic nerve. AcuNova treatment stimulates improved vascular supply to the optic nerve head, the area where the optic nerve fibers exit the eye. For patients whose progression continues despite controlled pressure, this addresses the blood flow issue that their current treatment cannot reach. Secondly, it helps with neuroprotection because acupuncture has shown neuroprotective effects in multiple studies, which means that it supports the survival and function of nerve cells under stress. So for optic nerve fibers that are damaged but not yet dead, this may meaningfully extend their functional life. Thirdly, intraocular pressure modulation. Some research has actually shown that acupuncture can produce modest reductions in IOP, not as a replacement for drops, but as a complementary effect that adds to lowering the pressure with the current medication. So what are your realistic expectations for glaucoma? AcuNova is not a replacement for your drops or your ophthalmology care. It is a complementary treatment that addresses what your drops cannot. So the goal is slowing or stopping the visual field loss that continues despite controlled pressure, and supporting the optic nerve with the vascular nourishment it needs to survive longer. So for patients who are losing vision despite controlled glaucoma, this conversation is particularly great. It's worth having because controlled pressure does not mean controlled disease for everyone. And if your visual field is still shrinking, something more still needs to happen. Next, I want to talk about diabetic retinopathy. It is the leading cause of blindness in working age adults in the developed world. And it is at its core a vascular disease, not primarily an eye disease, a blood vessel disease that happens in the eye. Chronically elevated blood sugar damages blood vessels throughout the body. In the retina, which is one of the most vascularly dense tissues in the human body, this damage is visible and consequential. The tiny capillaries that supply the retina with oxygen and nutrients become weakened, leaky, and eventually occluded. The retina is starved of what it needs. So it becomes more fragile and it scars and causes most of the visual loss. Diabetic macular edema is the swelling of the macula caused by fluid leaking from damaged blood vessels that can occur at any stage and is one of the most common causes of visual loss in diabetic patients. So let's look at conventional treatment for diabetic retinopathy. Conventional treatment focuses on blood sugar control, blood pressure management, laser treatment to seal leaking vessels, and anti-VEGF injections for diabetic macular edema. These treatments can slow progression and preserve vision, and they are very important, but they do not repair the damaged microvascular. So they do not restore retinal cells that have been lost, and for many patients, despite treatment, vision loss continues because the underlying environment of chronic vascular damage is not being fully addressed. I also want to say something to diabetic retinopathy patients, specifically because I see this in my practice and I want to address it directly. Many of you carry a burden of guilt about this diagnosis, the sense that your diabetes caused this and therefore you caused this. And I want to release you from that burden entirely because diabetic retinopathy is a complication of a disease. Managing diabetes is extremely difficult, and the vision changes you are experiencing are not a punishment. They are a medical condition that deserves serious and compassionate treatment. This is what we are here to offer. So now let's look at how AcuNova addresses and treats diabetic retinopathy. So first, it improves retinal microcirculation. It improves blood flow through the vasculature, addressing oxygen and nutrient deprivation that drives retinal cell loss. This is the central mechanism of damage in diabetic retinopathy, and it's why AcuNova works so well. Secondly, it reduces inflammation. Chronic inflammation plays a significant role in diabetic retinopathy progression. AcuNova's anti-inflammatory effects, well documented in acupuncture research, help to reduce the inflammatory burden in the retinal environment. And thirdly, it regulates blood sugar. Acupuncture has demonstrated effects on insulin sensitivity and blood sugar regulation in multiple studies. While we do not position acupuncture as a diabetes treatment, improved metabolic function is a meaningful secondary benefit for diabetic retinopathy patients that helps support the retinal treatment. Also, it complements the anti-VEGF injections and laser treatment. AcuNova addresses the vascular and inflammatory environment that those treatments do not reach, potentially improving their effectiveness and reducing the rate of progression in between the cycles. So let's talk about what are the realistic expectations for someone suffering from diabetic retinopathy. The earlier the intervention, the more we can help. So patients in the non-proliferative stage before significant structural damage has occurred have the most to gain from AcuNova treatment in terms of slowing progression and preserving retinal function. So just to summarize, we talked about 3 very different conditions, 3 very different mechanisms, and 3 different patient experiences. And yet, as I hope you can see, what AcuNova addresses is consistent across all of these conditions. Retinal and optic nerve microcirculation, reduction of inflammation in ocular environment, and neuroprotection of cells that are under stress. It supports the tissues that conventional medicine monitors but cannot nourish. The reason AcuNova works across such a range of conditions is that it is not targeting any one single disease pathway. It is improving the fundamental physiological environment in which the eye lives and functions. And that environment, the vascular health, the inflammatory load, the neural signaling is compromised in all of these conditions. So whether you are living with retinitis pigmentosa, with glaucoma or diabetic retinopathy, and whether you are in the early stages of your condition or you've been managing it for many years, I want to invite you to have a conversation before you accept that your current treatment is all there is. So call our office. My assistant will schedule you for an in-person or over-the-phone consultation, and you and I will sit down together and review your specific diagnosis and your current treatment and your imaging if you have it. And I will give you an honest answer to my assessment. You can learn more about our practice and the full range of eye conditions we treat at awpensacola.com. In our next episode, we're going to talk about what to expect from AcuNova 2-week intensive, what each day looks like, and how patients typically feel before and after treatment, and what actually the follow-up process involves. So subscribe so you don't miss it. Thank you so much for your time. We'll see you again soon.